For the patients, what we're trying to detect is we're trying to detect antibodies that target a water channel that generally is expressed in living cells in astrocytes. We know it's also expressed in the kidney, it's expressed in muscle, but in terms of the nervous system, it's expressed in the astrocyte. We don't tend to use astrocytes in the laboratory, so what we use kidney cells, human kidney cells, that are transfected. This is a human kidney cell line that's transfected with the water channel. And by transfecting the cell with the water channel, the cell now expresses the water channel on its cell surface. So then you apply the patient's serum onto this transfected cell line, and then you also have a cell line that's untransfected. And you apply the patient's serum to both, and then you add in an antibody that binds to the patient's antibody, but that antibody gives off fluorescent color. And so if the patient has an antibody that binds to the water channel, you'll be able to see it on the outside of those transfected cells. But you won't see it on the untransfected cells because those cells haven't been transfected with the water channel. And so just visually you can look down the microscope, and in the transfected cell population you'll see those bright cells, and in the untransfected cells you won't see, it'll be dark or black. And so you can very quickly distinguish patients that have the antibody versus those that don't. And I think it's a very simple concept and a very simple assay. It takes a short time to do, but it's very sensitive and very specific. And the potential of moving to flow cytometry basically just takes the human eye out of it and allows essentially a computer to analyze. And that obviously may potentially increase our sensitivity and specificity, but that's something that's currently in development.